Hi, good afternoon, everyone. Here we are again on another episode of Doctors Go Live on Columbia Asia Facebook page. Thank you again for being with us. Today's topic is especially for ladies, and it is about urinary incontinence. Would you agree that urinary incontinence can make the most confident among ladies become nervous and shy? Yeah, all it takes is one cough and you know you need to go change, but is it just inconvenience we're talking about, or is there more than meets the eye? So with us today, we have Dr. Jamali Wagiman, who is the Consultant Obstetrician and Gynecologist with a special interest in urogynecology at Columbia Asia Hospital, Seremban. Assalamualaikum, Doctor. How are you?
Waalaikumsalam. I'm good. How about you, Sakina?
Good, Alhamdulillah. Okay, Doctor, let's go straight into the topic. So maybe you can explain what happens when a patient has urinary incontinence. We're talking females lah. Yeah, what are the symptoms? What exactly is this disease? Is it a disease, first of all?
What is it?
Is it a disease? Do you refer to it as a disease?
No. Basically, many people don't consider this a disease. You call it medical condition. To some extent, that it disturbs their quality of life.
Right.
So,
okay.
Back to the symptoms. In general, all these ladies, basically almost all of them, basically have leakage of urine. Yeah. Normally, if you want to feel like to void or to urinate, toilet, on your own time, and there is no leakage. But in case of urinary incontinence, this is involuntary and normally occur while you cough, or you laugh, or while you actually change movement from sitting to standing positions and walking, lifting heavy weights and all that, daily activity. The urine will leak. So in general, I think probably many people don't consider this a disease, and although the underlying basically can be a disease process, but this is more towards how they actually affect their life. If it is very mild, most of the time women you just actually live with that until one day actually really affected their life. Only then they come forwards.
Yeah, true. I can understand how this can be of an inconvenience.
Exactly.
Okay, doctor, maybe you can explain what are the common patients that you have seen in urinary incontinence.
Yeah, most of the ladies that come to see me with this kind of problem, basically more than 45 years old. In fact, if you consider among ladies 45 years old, 1 in 3, it's quite common. You're almost like 30% to 40% of them have some of incontinence. But I would say most of the ladies who come to see me, because they will actually wait for some time, some of them like 2 years, 3 years, even 5 years before they come to see us. Most of the ladies that come to see me basically above 50 years old. In general, we call it in general they come to see me around 60 years old. So it's pretty old group of women, or we call it postmenopausals. We do have cases, perimenopause around 40, 45, you have this problem. But other than that, rather than incontinence itself, they also presented with some other problem, like we call it prolapse. I mean, part of the uterus be prolapsing out to the vagina. In fact, the bladder can be prolapsed, even the rectum also prolapse. We call it under the category of the uterovaginal prolapse. This woman can actually present to us with either purely prolapse or purely incontinent, but most of them, not necessarily so, they present with combination of both. They present with prolapse with incontinence. Some present with prolapse without incontinence. Some present with incontinence without a prolapse. Of course, this and disease process and all that requires some assessment. So we gynecologists will make assessment and suggest the appropriate treatment for this lady, not necessarily surgery. Because I know that many women actually really scared to come forward in case that they think that all the treatment can be surgery, and surgery can be very scary, right, to some women. But my advice, basically, if you do have some problem, whether it's very short term or long term and all that, with or without prolapse, you come and see and discuss with us first. Then we can identify what actual problem is, what actual problem they have. And then we can actually suggest the appropriate treatment, not necessarily surgery. I will tell you later. We have a few options, medical, we can have some conservative surgery, some procedures or even surgery as the last resort. Yeah.
Yeah. I think, doctor, I mean, in my opinion, lah, if anyone cares, is that yes, they could be, the patients could be scared that they might go for surgery, hence
Yeah.
they delay consulting a doctor, but it could also be something that they view as embarrassing because it has to
Yeah.
do, yeah, it has to do with, with a
It's a
certain
private
age
part.
control, you cannot
Yeah.
control yourself.
But you must remember that this incontinence to some extent can be embarrassing by itself. You know, I
Can we
will
go through it?
consider like our women nowadays not like women like
Mm.
30 years old, 40 years
Right,
ago. No,
right.
women are basically working women. They actually
Mm.
hold a position, have to meet people. They actually contribute to the even the economy of the country. So you have to meet people. You have to socialize. Uh,
Definitely.
Embarrassment or seeing doctors, you have to actually balance, which is all the embarrassment that you face every day. Incontinence can be look simple, although it's not a disease, just a leak of urine, but can be very the impact can be very strong in their life. I give you some example. Let's say you leak while walking, right? Your daily routine will be affected. Your performance can be actually reduced to some extent because you can't really meet people. You can go to seminar. You can go you can go travel without any difficulties. And to some extent, certain women actually do report to us that they have problem with sexual activities. When come to that level, then this is going to be like affecting their harmony of their marriage.
Yeah,
So
of course.
it's not all women come with all the problem, but
Mm.
each and everyone have some
Right.
severity. Very, very mild form, and then we can take it. But it is very severe before it actually is really affected your work, really affect your marital harmony and all that. You should actually come to see us. Forget about the embarrassment and all that, because our purpose basically just to find a solution.
Right.
All
Yeah.
right?
Yeah. That's a lot to do.
Come
There's a lot of
motivation
factors
for
there to take into
women
account.
actually come forward. Forget about embarrassment situation, private part, because these are like
Yeah.
private. But you're not seeing
Yeah.
anybody in gynecologists. We don't see things unnecessarily. Yeah.
Of course. Of course. Okay, doctor. Maybe we can talk about the risk factors of
Yeah.
urinary incontinence.
All right. The risk factors, as I mentioned just now, age-wise,
Okay.
gender. We talk about female.
Right.
We do have some male incontinent, but that one doesn't go to gynecologists. They go to urologists, and they have some underlying problem which is more prominent, like prostate hyperplasia and all that. So that part actually requires treatment rather than the incontinent itself, right? When it comes to female, and then totally separate entity. All right. So risk factor here about female incontinence, you are female. But what about age? As I mentioned just now, we talk about approaching menopause age, 45 and above. And in general, we talk about 60 years old. And I do have cases like women who come to me like 70 above, that
Oh.
70 years old is a bit so-called challenging to some extent, that that all women at that age, even men at that age, they have multiple medical problems. Let's say I were to post surgery, is going to be very challenging to some extent that we can no longer do any surgery. So that kind of cases, basically, I need to propose some form of treatment other than surgery. So you have to discuss.
Okay.
Overweight
Okay.
is rampant in Malaysia. Basically, overweight or even obesity, even morbid obesity. Now you see almost like every day, everywhere. Almost like 50% of us basically is obese anyway.
Yeah.
And smoking, I'm not sure, because our culture here in Malaysia, not many women smoke.
Mm.
Basically, right?
Mm.
Cases who do actually smokers among female, this become a risk factor also. Right? Family is
Okay.
much. I don't see much of family history. It doesn't really go by history like certain.
Oops. Okay. Something has happened. Okay. Let's give it a few
Yeah, sorry.
seconds.
The neurological
Okay.
disease,
So
some
it's
other risk
back.
factors.
Sorry,
Yeah, it's back.
Dr. Jamali, sorry, I'm afraid you were cut off just now. It might have been a connection problem. Maybe you
Okay,
can
all right.
sentences
Okay,
so
okay.
that we
The
can
last one before
what you were saying earlier.
family history.
Family history.
Okay.
Okay. Okay.
Family history, I don't think it is really like a very strong risk factors in terms of incontinence.
Mm.
It doesn't really go like certain cancers that if you mothers have cancer, you might have a high risk of cancer. But incontinence is slightly different. The only related is if your mother basically menopause early, you may actually menopause early, you may expose yourself earlier to have incontinence compared to other people. That's how actually the family history, so-called family history as a risk factor for incontinence.
I see. Okay.
Certain women, we talk about 50 years old, 60 years old in Malaysia, diabetic, it's quite rampant, right? Almost like everybody have diabetic. It's very difficult to see anyone without diabetic nowadays in Malaysia because of our food, because of obesity and all that. So if you do have some chronic problem with diabetic or some other pure neurological disease like spinal problem and all that, you do have some incontinence, but different form from the normal incontinence that I see every day. That one, we call it under urogenic, where the treatment is more towards the primary problem, like spinal problem and all that. The neurosurgeon will help you on that. My type as a gynecology, we are looking at condition towards prolapse or under the category of stress incontinence and urgency incontinence. I do handle cases with a few other team. If let's say gynecological approach is failed, I do actually get some support from neurology as well as neurologists actually to help me out in certain cases.
See, well, that means it does involve a few different departments, like it's not.
Yeah. In certain cases, complicated cases, we know that it's going to be like not single approach will help.
Yeah.
We have to be like,
depending on what it is.
Yeah, very rare cases.
Yeah. Doctor, you were mentioning just now about urinary incontinence being caused by stress. Stress as we know it, or stress.
Oh yeah, the word is stress incontinence. You're right. The word is stress incontinence, but it's not the stress incontinence. It's not like stress. I mean psychological.
Mind stress. Okay.
Stress incontinence in the sense that we classify that under stress incontinence if you have a so-called urine leak while you cough, or while you walk up the stairs, or while you change movement from sitting to standing position, or you giggle or something, that we call it the stress incontinence. Stress meaning that the stress on the bladder while your abdominal pressure is high. As we actually sneeze like that, you sneeze like that, actually the abdominal cavity pressure is high. That gives stress to the bladder, that leak. And then that kind of stress rather than psychological stress. Yeah.
Is that also connected to being obese because of?
Yeah, that's the same reason why obesity actually. Because the high pressure in the abdominal cavity. Same thing with smoking. Right. Consistent smoking, your high pressure in the abdomen causes frequent contraction of the bladder.
That's what. Okay. Now we get it, because I was thinking, if it's work stress and that. It's got nothing to do with that kind of stress.
Nothing to do with that. Yes, nothing to do with that.
All right, doctor, maybe we can talk about the triggers of urinary incontinence.
Okay. You can classify, I would say, the few triggering factors. How you have underlying problem. I hope people understand triggers, meaning that if you expose to these things, basically you're going to have incontinence, not necessarily so. So if your structure, your bladder structure, your urethra structure, everything is normal, so you wouldn't get incontinent if you're exposed to this thing, because many of us drink coffee, many of take alcohol and all that, certain medication and all that. But if you have underlying problem of that lead to incontinence, you will actually the condition getting worse. I give you some example. Another form of incontinence, we call it urgency incontinence. Urgency incontinence is slightly different compared to stress incontinence. Stress incontinence requires, for you to cough or laugh, giggles and all that before you leak. But other form of incontinence, we call it urgency incontinence. Urgency incontinence is even worse, because you know why? Every time you feel like go to toilet, you can't really hold too long. You have to rush. Basically, literally, you have to run to toilet. To some extent, this group of women will report to us, they can go shopping. If they try to go shopping, the first thing they locate is not the shop. They locate the toilet. Yes, they locate the toilet first, and they will shopping around the toilet. within the distance they can run, because otherwise you will leak. Other strategy, of course, they wear pampers. Not many people want to wear pampers, go shopping. So meaning the form. So this thing can be triggered with caffeine and all that. That's why to some extent, those who are really coffee drinker, hardcore coffee drinker, then at the end they have some problem of this urgency and all that. You try to reduce the coffee intake, it will actually reduce the symptom. Unless it is persistent, after certain method, then you have to come to see us. I need to give you some medication. The good thing about this type of leaking, you don't need surgery. There's no surgery for that. We have a few options of medication to handle that urgency incontinence, rather than stress incontinence.
Right.
Yeah, other than that, if you are pregnant, menopause, as I said just now, you have, say, gynae surgery, like hysterectomy, removal of the uterus and all that. Of course, you may have some problems with incontinence after the surgery and all that. These are a few triggering factors. Can be temporary, can be persistent, as I mentioned. So, but I want to elaborate more basically on this one, because what temporary and persistent is, how do you perceive your problem? Whether it's temporary or persistent. Temporary meaning that it will disappear by itself. Most of the time you don't see us, but if it becomes persistent, then you have to see me. To see me or some other gynecologist in that sense. Your but persistent can be divided into two, or even three to some extent. You can have either stress incontinence, okay, or you can have urgency incontinence, that the one that you have to rush to toilet. Remember, the stress incontinent group doesn't have urgency, they can actually relax, relax. If they want to urinate, they can just walk slowly to the toilet. The other group run. The other group, they have combination, they have both. They cough, they leak, and they have the urgency, and even night time also, they actually leak while sleeping. And on top of that, sometimes they actually leak while having sexual activity with the husband. So you can have incontinence, you have an urgency incontinence, you have a mixed incontinence. So all these three groups require a separate set of treatment. So that's why you have to come. Yes.
Which is the one that is most chronic, or could be a cause of underlying serious?
Yeah, all three is chronic. All type is chronic, but it depends, as I mentioned just now, how actually this problem affect your life. Remember I told you about like 30, 40 years old, 30, 40 years ago, where actually women actually working in the paddy field, in the rubber plantation and all that. They don't mind actually they leak, But now our women basically working in the office, meet people, meetings and all that. Don't take it anymore. All these things chronic. Basically all these three things very chronic. Sometimes can affect your life. So you have to see a gynecologist to identify what type of incontinence that you have, but the treatment can be specific for each one. All right.
Yeah. I think it could also be that some women are not aware that this falls under gynecology. Maybe they don't want to see a doctor. Sure.
Exactly, because certain women I noticed. That's why we realized that although we know statistically almost like 30 or 40% of women actually have incontinence, but only small amount of them actually come to see us. One reason, because probably you can say they're a bit shy to see a gynecologist, especially male gynecologists like me, or actually they know that this condition is treatable. It's not normal. It's not part of the so-called menopause life. Menopause is very healthy, happy, and all that. We try to actually teach all women. Menopause basically is a freedom. You don't have any menses, but all the other problems like incontinence and all that, you should actually come to see us to find some solution.
Right. No, I was just looking at the slide. It says pregnancy. That one I can relate very much, because a lot of women whenever they're pregnant kan macam sekejap-kejap they have to go to the bathroom.
That one we call it welcome to the club. All the pregnant ladies. You have all sorts of symptoms, including the incontinence. But the incontinence is obvious. You have enlarging uterus and all that, compressing on the bladder. Of course, you feel.
Yes. Okay. So that's what you mean by stress.
Yeah.
Okay. All right. So, doctor, how can you decide when should you decide to go and see a doctor? When does it become? Some women will just.
In general, as I mentioned just now, it can be temporary, it can be a very long and chronic. I would say Chronic, we can actually do now. Used to be like 6 months, but nowadays you don't really have to wait for 6 months before you come to see us. I would say it's persistent. 1 month, I think, long enough, I think, for you to suffer for this incontinence. You have to come to see us earlier. The most probably months, persistent. But nowadays, because the treatment is available, Colombia, Asia is everywhere, gynecologists everywhere. It's not like before. You have to see us as probably 1 month, I think, long enough for you to suffer. All right, and. So if the symptom basically really affect your life, because my life and your life is different, because your requirement to see public and all that is different. Unless you stay alone, nobody around, and of course you can actually leak all the way, but it doesn't really affect you. But as I mentioned just now I think all women basically have to be outside. You have to meet people, so you can't actually wait until 3 months, 6 months before you see us, right? So give some limit and really depend on how much actually affect your life. The moment it affect your lifestyle, the moment you affect your marital status and all that, you have to come to see us. All right?
Right, yeah, that's very true. Yeah. Okay, now let's talk about the treatment options. Oh no, sorry, we need to talk about the prevention of female urinary incontinence.
Okay, as I mentioned just now, obesity is part of the cause. So this why we keep on mentioning obesity as a part of the problem and part of the solution. You know why? Because this is, we call it the modifiable, thing that we can modify. If I say I'm talking about the factors like age, you can modify your age, right? Let's say you're 60 years old. I can't make it like 40 years old, cannot, right? Because it's unmodifiable. So if you're a smoker, stop smoking. If you're a coffee drinker, reduce the caffeine, lifestyle wise. But the main thing, if you are body weight, body mass index, it's very easy to calculate. It's more than 30. Reduce it to 25 or even below. All right. But to be ideal, I think if you say your body mass index say 40, I don't actually encourage you to go down until 25. We go slow, like 10%, 10% every 3 months to 6 months to have some reduced body weight as we go. So to get towards 25. All right. The other is many people go to gym, many people go for exercise and all that. They forgot one thing, especially women. They have to do pelvic floor exercise, or also known famous as a Kegel exercise. People talk about Kegel exercise and all that, but they don't do. In fact, certain cases they already have some incontinence. We give some say trial of treatment, 3 months, 3 months of trial of Kegel exercise. It won't work. Because I don't know what happened, because many Malaysian, when you reach 50 years old, look like exercise is not routine anymore. You forget about your Kegel exercise. Even normal ordinary exercise is also very, very lacking, right? So, but pelvic floor exercise is very good way of prevention. In fact, you can do now. While talking like this, also you can actually do exercise. If you don't know Kegel exercise, you can see one of any physiotherapy to guide you what muscle to contract, otherwise contracting different muscles, which just doesn't really give you a good effect on the incontinent part of it. But the good thing about this exercise, basically you can do almost any time, anywhere. Doesn't require any, gym registration and all that. Even yourself. But the only thing, you have to need some help just to identify which muscle are contracting. You are targeting the actual muscle in the pelvis. All right. So other than that, coffee drinkers, alcohol and all that, I think probably you have to reduce. The other thing is try to avoid so-called constipation. Nowadays, this obesity, very poor diet, exercise and all that give you some constipation. Constipation can lead, in the long term, can cause incontinence as well. To some extent, can UV prolapse. And if you are smokers, especially so, women in Malaysia become secondary smokers. Try to avoid primary smokers, even secondary smokers. To say that if your husband is smokers, ask them to stop. That's a few that you can do. So beyond that, the moment you have some problem, some symptom of incontinence, measure is no longer useful. You have to see us for secondary measure to avoid worsening as well as to treat the condition.
Yeah, Doctor, one of the things that you mentioned just now, prevention, avoid bladder irritants, acidic foods, for example?
Acidic food?
About citrus ke atau?
I'm not really sure about that. I think probably caffeine and alcohol is quite obvious. I'm not really sure.
Okay, no, get that.
Probably I will get to you later.
No problem. It's okay because we can add to the comment section later, kan? Okay, let's talk about treatment options now, because apparently there are quite
treatment option, as I mentioned just now, some of the treatment can be done at home, all right, especially those pelvic floor exercise. This is a very mild, I would say. You can do 1 or 2 sessions with physiotherapy. You have to see physiotherapy nowadays. Even among doctors who have some knee problem, whatever joint problem, go to physiotherapists. There is so many physiotherapists, whether government or private sectors, or some center doing a physiotherapist business. I mean, services. Then you can go to them, ask them how to get a proper pelvic floor exercise. But you have. Other than that, I want to show you one device. I bring 2 device here. Can you see it?
Okay.
This is a ring that look like, exactly. So this is a ring. So this ring made from silicone. We call it silicone ring, or you call it a vagina ring. So this is also I insert into the vagina to prevent. If you do have, say, vaginal prolapse, I put this inside while waiting for surgery, or for those who are not suitable for surgery. Let's say you are 75 years old, 80 years old with prolapse and incontinence, and then I put this as a part of the treatment. Other than that, let's say the best, of course, is surgery, but not everybody, like to have surgery or fit to undergo some surgery. So this is another ring, look like a real ring, but this is also silicone. Especially this one have some so-called bulging here. So basically, I have a small bladder here. If people can imagine, this is your bladder with little bit of so-called the opening here. So this one in the vagina. So this one actually will hold the urethra, so that whenever you cough, so this one will hold and hopefully will prevent the leaking. But so these two is, we call it a ring, or incontinent ring, or vaginal ring. This is purely for while preparing for operation, or I mean, let's say the surgery will be done, say 1 month's time, or maybe 1 week's time. Before that, and then I put the rings, temporary. Or for those who are really cannot go for surgery, I will put this in the vagina and replace it every 4 months, the most about 6 months. So this is part of the so-called conservative non-surgery, other than exercise. The other form, the last one, I think, especially for those who have, say, stress incontinence and those who have UV prolapse, the option of surgery can be either correction of the pelvic floor. We call it a pelvic floor repair. At the same time, most of the time, we have to remove the uterus through the vagina. So that's why this type of surgery have to be done through the vagina. So meaning that there is no incision on the abdomen. All the surgery basically through the vagina. We call it a vaginal hysterectomy, anterior and posterior pelvic floor repair, perineoplasty, as well as a tension-free vaginal tape. So basically, there is 3 or 4 surgery done together purposely for this, specifically for this problem. So this, if you see around gynecologists with say urogynecology, with urogynecology services, like me myself in Seremban, I'm offering this service, say for vaginal surgery as well for incontinence surgery. So this is exactly what we did, but it's specifically for stress incontinence with or without UV prolapse. For ladies who have say urgency incontinence, I will try with medication first. For ladies with combination of stress incontinence and urgency, they need both. But how I do, which one I do first, is depend on which severity. If the urgency is more severe, I will try to give medication first and see whether that kind of situation is suitable enough for her. If it's still very disturbing and all that, we still go by the surgery at the end of the day. Or let's say this lady has some combination, but the leakage is so prominent, I will do the surgery first. But after the surgery, she still needs some medication to handle the urgency. You see, so many women have different requirement and all that. The outcome also different. It's not 100%, but so far, as I mentioned, for tension-free vaginal tape, specifically for stress incontinence, the success rate can be as high as 90%. So meaning that I got so far, basically, every year, I think we insert almost like say 20 or say 30 vaginal tape. Only 1 or 2 came back with a very minor problem. Most of them basically disappear. They're happy with their life. They don't come back to see me anymore. Not to say that they don't like me. That means the problem is cured already. So that's the whole option that we have for incontinence, either exercise or even medication, ring pessaries, or even the surgery. Women have to
Yeah.
know that.
So it does sound very straightforward.
Yes.
Okay, what if, sorry, are you done with the surgery explanation just now? Before I
Sorry.
interrupted you?
What I want to say just now. So meaning that women in Malaysia have to know that the incontinent do have a treatment, and it is not normal. I don't encourage them to suffer. Keep
Yeah,
them
yeah,
shying around. You don't mix up. You
yeah.
reduce performance. Husband runaways. All those.
Mm-hmm.
Just because of that, it's not worth it. I think
Runaway of incontinence.
come see us discuss, and then you might have you're lucky enough, you find one gynecologist that can really help you.
Okay. All right. I had a question just now. What if urinary incontinence among females go untreated? Will that progress into something that's more serious, or it's just inconvenience?
It is inconvenient, but to some extent, remember that when you talk about working women,
Yeah.
it may lead to one other condition called anxiety and depression, because they really
Oh, I
they're
see.
slowly getting away from socializing. You know,
Right, right.
slowly
Yeah.
they will the emotional part of it will come.
Mm,
Social part of it will come. They will go depressed. They will go, the
yeah.
performance will reduce and all that. So the total quality of life will be actually deteriorating. So
Okay.
the one that I
Yeah.
mentioned, the husband run away and all that, sometimes can be very real.
Mm,
Because when you have some stress incontinent, so you can't have no longer having a sexual activity without leaking. So all of us basically adult, most of what the couple who come to see me, they come husband and wife together in the room so that I can actually explore what exactly they have problem, because otherwise they don't voluntarily tell you that, doctor, I have some problem with sexual activities. So in fact, the moment I open up like that, then they only say, yes, we do have some problem. So then
mm,
the incontinence is not just incontinent and all that, but it may actually affect your emotional, your performance, your quality of life overall. To some extent, that may actually induce towards the anxiety and the social so-called disturbance.
right,
Right?
right. Okay,
But it will not become cancer and all that, because as I told you, this is not
mm,
like a natural disease that become a cancer, progress to
yeah,
cancer.
right.
It may
Mm,
worsen. Some women actually, if they come too late because of
mm,
constant irritation of urine on the skin, you may have
mm,
some problem outside of the vagina because of
mm,
scratching and all that. Yeah,
yeah. Wow. So it can actually branch out into quite a few
it
other
is. It
things.
is. Yeah.
So
Mhm.
the moral of the story is go and see your doctor.
The best come forward. The best come forward if to any gynecologist, especially in general gynecology will help you, but when it comes to
Yeah.
surgery, you have to go to specific gynecologists with urogynecology specialty.
Okay. And which is your area, Dr. Jamali,
Yeah,
obviously.
in Seremban basically is my area. If you go
Yeah.
to Asia Seremban, basically me, myself, and two other doctors, Dr. Intan and Dr. Peng. Yes.
Yeah. Okay. All right, doctor, we're going to address some of the questions that we have now from.
Yeah, sure. Right.
Okay, first question is from Ms. Nurfatin Issa. Hi, Dr. Jamali. Do Kegel
Yeah.
exercises prevent incontinence? I think you mentioned this earlier. Maybe we can just do a quick recap about this.
Yeah, as I mentioned just now, Kegel exercise basically is 100% recommended for
Mm,
the women, because this is involving the muscles at the pelvic region. So
yeah.
the more tough the muscle, the less possibility of the organ to be prolapsed and producing incontinence. So I would say any women, I would say, don't wait until you reach age of menopause to do a Kegel exercise. You can actually
Mm,
do it now. If you do now, it's not only preventing incontinence later, but at the
yeah.
same time, we call it the Kegel exercise. At the same time, will improve the vaginal tightness. So I
Right.
get a very adult session. So when I
Yeah.
talk about vaginal tightness, And then this is another area of women that we gynecologists with urogynecology actually handling. We talk about vaginal laxity, where the vagina become very lax after delivery of say 3 or even 5 babies. The vagina become very lax, and that one can translate into some sexual dissatisfaction, I would say. It depends on how the couple actually perceive that, but it can lead to the sexual dissatisfaction because of vaginal laxity. They do come to see us actually for we call it a tightening procedures. We do have some treatment nowadays like vaginal rejuvenicities and all that. But originally, actually, we can actually handle that with Kegel exercise. Plus, if it is too bad, with the surgery, we call it colpoperineography. That one also belong to urogynecology area.
Oh, I see. But
we treat leakage as well as vaginal laxity for those who have some very lax vagina, because they never do Kegel exercise at all in their life. So back to the question, basically Kegel exercise, even leaking, tighten the vagina.
Does this have anything to do with cosmetic gynecology, or that's a separate together?
No, cosmetic have some additional. When you talk about vaginal, we talk about, say, you got a very large labia minora and all that, so they will actually repair and all that. It's more aesthetic part of it. But urogynecologists, I mean, when I do a vaginal surgery for this one, is purely because of vaginal laxity, we call it, because our approach is towards the so-called structural repair of the very lax vagina or prolapsed vagina back to normal meaning as tight as before. So that's the word, we make it tight.
Okay, all right. Hope that answers your question, Ms. Nufatinisa. Okay, let's take a look. I'm sorry?
I just said
we got questions, they're all coming in. Okay, one is by Ms. Cecilia Chong. Can hormonal changes cause incontinence?
Yes, thank you, Cecilia. Hormonal changes, many people so-called take it hormonal changes in many ways. Even before menses, you have some hormonal changes. After menses, you got premenstrual tension and all that. But I think in terms of incontinence, we talk about menopause. By being menopause, so meaning that by the time you reach menopause, 45 years old, you got so many things to take care. Number one, basically your hormonal status. I mean, your hot flushes, your body ache, your mood swing, and all that. That one can be handled by the hormone replacement therapy. Down below, sometimes inside menopause, you start to have some problem with vaginal laxity. You start to have uterine prolapse. You start to have incontinence. All these things. If you do have problem, that age, so you should actually come to see us, because this have to be here, because and this is not under the so-called disease that not every doctors can diagnose. You have to see gynecologists. Say women screening, after one you menopause age, you have to come to see us for, say, ultrasound, annual, pap smear, and all that. That one you don't have, you cannot forget of doing. Because otherwise, by the time you reach menopause, and so many things will happen. Say after 5 years after the menopause.
Okay, it's always good to be vigilant one's own health. Okay,
yes.
If we hold our urine, this can be affected in future when we get older. Okay. She means that if you keep holding it in, so it's going to be affected in the future. I think one of the most common things that we hear of is batu karang. Is that is that true?
To me, if you hold your urine purposely, of course, actually expose yourself to, say, formation of the stones and all that. Incontinence. In terms of incontinence, I don't see much of the causation basically. It's really, but the thing is, if you in incontinence, basically you can't hold urine. Even normal volume of urine, you can actually hold. I told you about the urgency just now. Normally, we can hold about 300 cc of urine. 300 cc, almost like one small bottle of mineral water, like that. Or maximum, you can hold about 500 cc, almost half liter.
Wow.
but by then you have to physically squeeze. Let's say you're in the middle of the workshop that you can't go anywhere, and then you can hold until about 500 cc. But to have urgency incontinence, they hardly can hold 100, even 100 cc. To some extent, that if your urine production actually is normal, all right, so every 2 hours you have to go to toilet. There's a problem.
Maybe that's why some people, they don't want to drink so often.
Exactly. Exactly.
Yeah, it's actually
Some old
encouraged to drink
ladies might drink
water.
because they don't want to have urine because every 2 hours they have to go to toilet. Just imagine, let's say you were to travel from Johor Bahru to so long distance travel.
Yeah.
You totally avoid drinking, so that because the time they feel like going, they cannot avoid. They have to run to toilet, and you are in the middle of traffic jam. So then become a big problem.
Yeah.
Anyway, back to the question just now. That's holding the bladder
Yes.
cause not on the incontinent part of it.
Okay. All right. Ms. Winyap has a question here. Hi, Dr. Jamali. My friend told me not to go full force when we ladies go to the toilet. Oh, this is a new one. It should be control and release the urine slowly. Is this true? Will this cause incontinence?
Okay. Very rare you have this kind of question, right? So I tell you what, you whenever you go for to toilet to pass urine, if you really count, most of us will pass within 20 seconds. There's no reason, there's no health benefit to hold and stop and go, stop and go, stop and go like that. There's no reason for that. I don't know any special benefit for that. I don't know any specific problem with that, but it will not help in terms of prevention of incontinence later. So the is, if you find you want to pass urine but it's by itself, stop by itself, then we call it hesitancy. Very rare happen in women. Most of the time happen in men because of prostate hyperplasia and all that. All right, but in women, I think you don't have to do that. My advice, basically, you don't need to do that. The stop and go, stop and go, stop and go like that. Just let it go. Let it go. 20 seconds, done. That's it.
Okay. All right. No, I was asking just now, could it be Kegel exercises? Kegel or Kegel, however you pronounce
Kegel
it.
exercise don't have to do while urinating. You do Kegel other than time while you're not during the urination. That's
Okay.
not
That's
Kegel.
not Kegel. Okay. Ms. Haning Fauzan is asking about Kegel exercises during pregnancy. I'm not sure the angle of this, but do you have any comments about doing Kegel exercises during pregnancy?
Kegel can be done anytime, even during pregnancy.
Okay.
But I tell you, in pregnancy, let's say you do exercise at the same time, you know that your uterus basically enlarging with the babies and all that. You actually the condition is fighting to each other. You can actually do, but normally you don't really like put Kegel exercise during the pregnancy, but you can do. There is no issue with the pregnancy. It will not cause abortion. It will not cause premature labor and all that. It will not improve anything during that so-called pregnancy time. Because ultimately, the big impact on the human pelvic floor is during the delivery. During
Right.
actually the baby and the uterus contraction and delivery itself will actually stretch every single muscle and fascia in your vagina to the maximum. That's why actually when exactly the whole injury will take place. The more delivery you have, the more damage will done in the pelvic floor, the more high risk of pregnancy. I mean, the more high risk of incontinence later. That's why we see a group of women with incontinence. Normally, they have menopause, they have six baby, all are normal
Yeah.
delivery. But even let's remind that, although because I mentioned the normal delivery is a cause of incontinence, you don't go around and doctor, please do scissor on me because I don't want to have a incontinence later. No, the decision is not that way. We know this is a part of the risk, but if you do pregnant now, you don't go requesting for cesarean section just because Dr. Jamali tell you that this is causing the incontinence later. No, and they want to separate a decision purely obstetric part of it. Yeah.
Okay. All right. And don't use that as a contraceptive.
Yeah, no. Yeah, I mean the best is contraception. So numbers of pregnancy limited, to less than 5, and every 2 years. So you see, now obstetrics and gynecology actually linked to each other to some extent. That contraception, numbers of delivery, mode of delivery basically affect your so-called female performance later in your life.
Okay, okay. Let's take a look at the next one. Does menopause contribute to incontinence?
Does menopause contribute to incontinence? Yes. You know what happened? After menopause, many of you basically have, say, so many deliveries. The collagen part of it for body become very minimal, you know. The pelvic floor become very loose and relaxed, you know. It's more, that's why you see this group of women basically most of the time in 50 years and above, you know. It's do relate with menopause. So in that case, does the hormone therapies and all that help in the sense of delaying the event? Yes. That's why I say most ladies nowadays worried about having hormone replacement therapy after menopause because of some talk about cancers and all that.
Yeah, that's right.
You see the doctors first, you know, they will actually evaluate whether you are actually fit for hormone therapy or actually you are actually contraindication for hormone therapy. Let doctor decide, because all these things basically is a medical decision. It's not simply one single WhatsApp or even one page of information that you read over the internet. So doctor will decide whether you are safe or not. Hormone replacement therapy after menopause is very useful. We can't actually change your age. We can't actually change your situation. We can modify it to some extent. All right.
I see. So memang each case is different lah.
Yeah, each case is different. That's why you have to come to see.
Everybody, not across the board.
Don't make your decision on your own. Once you are given option, and then you to decide which one you want to have.
Okay, all right. So we need an expert opinion on that. Go see Dr. Jamali.
You need an expert opinion. So in this case, basically, you have to see gynecologist.
All right. We have a question here from Ms. Grace Bing Bing, and she's asking, "Hi, doctor. After uterine polypectomy, or I think, doctor, you have to explain what this is. Can this cause incontinence and painful urination?"
Not exactly, because uterine polyp basically is a benign growth, non-cancer growth in the uterus, or sometimes they came out through the cervix. Normally, what doctor did basically just a simple polypectomy, a simple surgery, basically twisting, and stop the bleeding at the point of the so-called the pedicles.
Oh, I think he twisted a bit much. Okay, I'm so sorry. I'm not quite sure what happened, but maybe we just give it a few seconds and see if Dr. Jamali will be back with us. If not, okay, something's happening. Hello, Dr. Jamali, welcome back.
I'm here. I can see you.
Oh, okay. Did you hear me talking? Because
I can hear you. I can see you.
Oh, that's really weird. Okay, connection. We're doing the twisting suddenly it just went off. Maybe you want to resume.
Okay. I mentioned just now about endometrial polypectomy. So polyp basically growth in the uterus, it's a simple growth, look like macam buah anggur ada tangkai like that lah. So, and most of the time this one can stay in the uterus, or sometimes they come out through the cervix. If it is come out to the cervix, I can see from the vagina, I can twist it around and detach it from the uterus. Otherwise, I have to go in, do a simple hysteroscopy and take the polypectomy out of the uterus without removing the fibroid. So the thing is, does it affect the incontinence later? The answer is no, because there is no relationship between the doing endometrial polyp, the structure, and the incontinence. Remember that incontinence basically is the bladder and the urethra problem, not at all in the vagina or in the uterus. But because the structure is so nearby, anything happen to the uterus, anything happen to the vagina can actually affect the the bladder and the urethra. And it's happened that in the women do have bladder, women do have vagina, women do have urethra, not like men. So men different, totally different. Yeah. So that's why vagina, uterus, bladder, and urethra in women actually interlink each other. But in case of polypectomy, it's affected that way.
Yeah.
Okay.
Okay. It seems that we don't have any more questions from our viewers, but I have one question. Okay, doctor, say someone has incontinence, but not during the daytime, only at night, like adult females. Does that count as well?
Yeah, we call it nocturia.
Okay, there you go.
Meaning that you bedwetting malam saja. So most of the time you actually have to wake up 2-3 times to toilet at night time. that one basically is under the category of urgency incontinence. They
I
sometimes,
see.
very weirdly, most of the lady with urgency incontinence, they have to run to toilet at daytime. They have to go to toilet like 8 times per day. But daytime, sometimes they don't have problem at daytime. Nighttime, they have some nocturia, meaning they have to go to toilet more than 3 times while during the sleeping hours. At the end, they will go very sleepy in the morning. They are very tired. They can't really have a good sleep and all that. That one under category of urgency incontinence. The treatment more or less the same as a stress incontinence. Come to see us, we give a treatment and solve your problem.
Okay, thank you so much, Dr. Jamali. It was
Thank you,
wonderful to
Sakina. Thank you.
you
And thank you everyone who
about the
listening to our session today. Thank you very much.
Thank you. Okay, thank you, everyone. That's all the time that we have for you now. Inshallah, we'll see each other again. Bye.